Our final story tonight is Jamie Bullock, who is another faculty member from the School of Nursing and Population Health.
Earlier this year, I had a lollipop moment. A full year prior, I was headed off on a massive ski adventure to go cross-country skiing with my whole family in the White Mountains. I was traveling with my husband and our two little girls, ages 3 and 6. Also with us were my husband's parents, so we had a full crew. Starting off on this adventure, I knew that I had to be very prepared. In order to do this, I took along with me a trailer that had skis on it. That trailer hooks around my middle, and that's what I ski with the whole time. Generally, my 3-year-old will ski on her own for quite some time, but then gets tired and rides in the trailer. My 6-year-old, however, is always on her skis. She leads the pack in her neon pink waterproof snowsuit. And initially, I thought, maybe that suit color is too much. But after the past year and a half of skiing behind her, I realized it's an amazing way for me to keep track of her while she's barreling through the woods. This particular day was a bluebird day, the kind of day you look forward to in the winter. It was an unbelievably well-groomed and gorgeous cross-country ski track, and we headed off on a 6-mile loop around a mountain. This was an absolutely beautiful trip. We made sure in our ski trailer to bring with us our trusty sub-30 LL Bean sleeping bag, as well as a fleece sleeping bag, and as many snacks as you could possibly imagine. Generally, we always bring hot chocolate. This time, we had 2 hot chocolates because my father-in-law and I forgot to discuss who was bringing the hot chocolate. But anyway, it all worked out. We had an absolutely beautiful day ahead of us. We headed on this trail, again, following my 6-year-old in her bright pink snowsuit. And she was the first to come across a sign that said, "Caution, steep hill." Now, she can read at this point, but she went for it. That's the type of kid she is. So she started down what was initially a more gradual decline or descent, and then became a very steep drop at the bottom. I, as you can imagine, was wearing the ski trailer, but I skied faster than I have ever skied in my life to keep up with her. It was a little bit scary, a lot of bit scary. And when we were at the bottom of the hill, I thought, wow, that was exhilarating and terrifying, and I need to make certain to not do that again. So we skied the additional 1.5 miles out and headed off for the rest of our day. The next day, we decided, wow, that was beautiful yesterday. We should go back. This day was a little bit gray, a little bit overcast, and a little colder. As you can imagine, because of the nice warm sun the day before, that drop in temperature and snow melt made for pretty icy conditions underneath our skis. Now that generally can be pretty fun. It means you go a little bit faster when you're cross-country skiing. And so we headed off on our route and came around the mountain just in the same way. Now in the middle of our trip, my husband and I checked in with each other. We said, hey, we really shouldn't do that hill again. That was too much. That was scary. I'm glad that everything worked out, but that was a little scary. We both agreed. And as our oldest got to that point with the caution hill sign, she stopped. And we all started to take our skis off. At that very moment, a woman who was in her mid-60s came running up the hill and said, "Stop, do not go down this hill on your skis." Luckily, we had our skis almost off. She shared that a person had fallen and was at the bottom of the hill. We started to walk down the hill, which is no easy feat when you're strapped into a ski trailer, but we made it. And we came to find an older adult lying on the ground at the bottom of the hill. They had attempted that hill, that steep descent, and had had an accident. I realized that this person was seriously injured, and I took a moment to think, is there enough time to get my little girls away from this situation so I can go back and help? I realized that the person was talking, that the person was breathing, and I managed to step 100 feet away with my children and my family and set them up and quickly ran back up the hill. I got down on my knees and started to talk with this person. I started to do an evaluation, an assessment. I wanted to see what was happening with them, and I also wanted to do what we all know so well in healthcare, which is to assess what we might need to do next. I found from the people who had found them at first that they had called the emergency medical service and that they were told it would take 45 minutes for them to get there via snowmobile. I knew based on the likely injury of this person that I should not move them. And so I quickly decided that my biggest concerns were that of hypothermia and potentially shock. I ran back to my ski trailer where luckily I had a -30 LL Bean down sleeping bag. What are the odds? I ran back up to the patient and I put it on and I covered them up. I got the fleece sleeping bag and I covered them up. I took my jacket off and made it their pillow. I then took all the hand warmers that I had prepared for the cold little hands, warmed them up, and offered them to the person to warm their chest. I found that the people that had found them were offering the person little pieces of chocolate candy because they had no idea what to do. And I said, "Stop." I knew that this person was likely going to need surgery as soon as possible. Soon thereafter, we found that the person was completely alone. And so I gave them my telephone and they called their spouse. They weren't able to reach them. The one thing I noted from the conversation was how incredibly calm and factual the person was about the situation. If I was calling my spouse, I don't know if my spouse could have understood what I was saying because I'd be blubbering so much. But they weren't able to reach them. About 45 minutes after I had initially gotten there, I heard the whir of a snowmobile, and I was so relieved. 2 paramedics came up with a sled trailer behind them, and we ended up getting my husband to come help, and we all worked together to keep the person immobilized while we brought them to the sled. Now, knowing the injury they suffered and knowing how much pain they were in, I drew on things that I have done in the hospital time and time again, where I use guided imagery to help them, talked them through their pain, talked them through what to expect. Yes, this is going to be very painful. Yes, there's nothing we can do to help you. Yes, we are going to work on something that you find positive in your mind to help relieve what must be excruciating. As they drove off, I knew that they were in good hands. I went back to my family and I checked in with my daughters. I checked in because I wanted to know how they were doing. I wanted to know that they were okay despite what was a very intense experience, despite having to watch mommy be nurse practitioner mommy and what that means and what that experience is like for small children. We skied our way out that day, the 1.5 miles, and the sun was setting as we got back to the parking lot. I dialed that number once again, and I reached their spouse. I explained what had happened. I explained the hospital I assumed that they would be taken to, and we got off the phone. My family headed back to Maine that night. We stopped for pizza. We got dessert. We tried to do everything we could to uplift the scenario. And that wasn't our last time skiing that year. And it wasn't our last time skiing this year either. We ski a lot. And often we would see an older adult while skiing and think, wow, that's intense what happened when that person was skiing alone and they were seriously hurt. That is intense. And we'd wonder, I wonder what happened to them. For a couple months after the accident, I did check the local newspapers. I did check to see if there was any word of what had happened because I feared some of the worst and really hoped for the best. A couple of months ago, I got a phone call. That date didn't ring a bell in my head, but it meant everything to the person who was calling. It was 1 year from the moment of the accident, and this person had spent the past year trying to figure out who I was. They called me and they thanked me for saving their life. They thanked me for how calm I was. They thanked me for being there on that day and being prepared as I was to help them. They shared that they did have surgery after the experience and that the very next day they were going in for their last surgery to get them back to where they were before the accident. This was so powerful. This gift, this lollipop was telling me I truly mattered to this person and I truly made a difference. And that bond that we share, that I share with someone who is a complete stranger before that moment, is a bond that will stay with me for my entire life. Thank you.